This is Dr. Jonathan Lebowitz at Lebowitz Plastic Surgery, located in Huntington, Long Island, New York, and today we are doing gynecomastia surgery on a gentleman who has a combination of excess chest fat and also male breast. Today we are doing smart liposuction to melt the fat and tighten the skin of the chest. We've already given local anesthesia and made one little entrance point to put the laser into the chest area to mix and match wavelengths. First to melt the fat of the chest, and then we're going to switch the wavelengths over to shrink the skin and tighten the skin, almost like a shrink wrap. Once we do the liposuction, the laser first, the wavelengths to melt the fat and tighten the skin, we're then going to liposuction through the same hole. And then finally, we're going to make a little smile incision under the nipple to remove any remaining excess glandular tissue, which is harder and unable to either melt or liposuction out. We're going to start with the right side, which has been numbed already, and then once we're done with this, we're going to go over to the left side. So here's the laser, and we're going to put that into the area. And you can hear the snap, crackle, pop. And you can see the laser under the skin. Okay, so now we've lasered, melted the fat deep, and then tightened the skin, and now through that same hole, we are liposuctioning. And I've got various type of cannulas, thicknesses, and tips that target where I want to go. Okay, now we're going to make an incision. So now we're closing. This is Dr. Jonathan Lebowitz of Lebowitz Plastic Surgery. So we're just completing bilateral gynecomastia treated by a combination of Laser Smart Liposuction as well as direct glandular excision. The Laser Smart Liposuction was to melt the fat and to shrink wrap the skin to remove the fatty portion of this gynecomastia, and then the direct glandular excision to remove the gland itself under the nipple areola. After all it's done, the skin then, over the period of a couple of weeks to a couple of months, shrinks down and you have a tight contoured chest. So now we've just putting the finishing touches on this left side, at which time we'll dress it just like the right side, put them into a pressure dressing garment, and a cup of tea will be waiting for him in the recovery room, and we'll let him sit for a few minutes and he'll go and get some lunch. If you have gynecomastia or any other cosmetic conditions that I can help you with, please call Dr. Lebowitz at Lebowitz Plastic Surgery at 631-424-0101. Thank you.